Now, the pathogenesis of primary hyperparathyroidism, we already discussed in detail the causes of primary, secondary, and tertiary hyperparathyroidism. Now, pathogenesis, if we see increase in secretion of parathyroid hormone from the primary process, that's important. Primary parathyroid gland are responsible in primary hyperparathyroidism, and there is increase in the secretion of parathyroid hormone from primary source or primary process. Parathyroid adenoma, again we talked about this. The single parathyroid adenoma is responsible for most of the cases of primary hyperparathyroidism. Then parathyroid hyperplasia, 15% of the cases. Parathyroid carcinoma, 5% of the cases. These are the three most common causes of the primary hyperparathyroidism. And then the calcium sensing receptor expression is decreased. This is the case even if the calcium level is not low or increased, the sensors are affected that can receive the signal from the calcium. If they are not responding properly, then we have the again primary hyperparathyroidism. So calcium sensing receptor expression is decreased.